Good afternoon. I, Priya Sharma, Assistant Lecturer in Child and Nursing Department at Chaitram College of Nursing. Today, I will deal with the topic Essential Newborn Care. In this topic, Essential Newborn Care, firstly, we will deal with the introduction, then the basic needs of a newborn after birth, and the immediate care after birth, and the Apgar scoring, and the routine care of the newborn. So, firstly, we will deal with the introduction. In introduction, the first hour after birth has a major influence on the survival, future health, and well-being of a newly born infant. The have an important have an important role at this time. The care they provide during this period is critical in helping to prevent complication and ensuring survival. All mother need help, support, and advice in the initial few days after delivery to ensure proper care of their newly born child. The basic need of a normal baby at the birth, that is a warmth, normal breathing, and the mother's milk, and the prevention of infection. And the 10 points that are immediate care that are very important in the immediate care of a newborn. The first is the call out the time of the birth, deliver the baby into a warm, clean, and dry towel, or keep on mother's abdomen or chest. Wipe both the eyes separately with sterile swab. Clamp and cut the umbilical cord after 1 minute. If baby breathing well, immediately dry the baby with a warm, clean towel or a piece of cloth. Assist the baby's breathing while drying. Leave the baby between mother's breast to start skin to skin care for at least an hour. Cover the baby's head with a cape. Cover the mother and baby with a warm cloth. Place an identity label and band on the baby. Encourage mother to initiate breastfeeding within half an hour of birth. Then firstly, call out the time of birth. It is very important to call loudly because it will help to recording accurate time of the birth, and more importantly, it alert other health personnel for the help if needed. And receive the baby on a warm and clean towel to prevent hypothermia, and the baby should be delivered in a warm clean towel and kept on mother's abdomen or chest if it is not possible, so kept the baby in clean, warm, and safe place close to the mother. And immediately dry the baby with a warm clean towel or a piece of cloth. If the secretions are present, to firstly suction the baby. It will prevent the aspiration and also stimulate for baby for the breathing. And blood or meconium on the baby's skin should be wiped, but the vernix should not be wiped because it will protect the baby. And wipe both the eyes with sterile swab. Clean the eyes using skin to skin care. Once the cord is cut, the baby should be placed between the mother's breast to initiate skin to skin care. This will help in maintaining the normal temperature of the baby as well as in promoting breastfeeding. And cover the baby's head with a cape. Cover the baby with a warm cloth. Both the mother and the baby should be covered with a warm cloth, especially if delivery room is cold. And place an identity label. It will help in identification of the baby and avoiding any confusion. And encourage mother to initiate exclusive feeding, breastfeeding, and breastfeeding should be initiated within half an hour of birth in all the babies. And the Apgar scoring, there is a 5 point, that is activity, pulse, grimace, appearance, and respiration. We will give a 2 point, that is 0 point, 1 point, and 2 point. That activity, if the activity is absent, then we will give 0 point. Arm and legs are flexed, then we will give 1 point. If the active movement is present, then we will give 2 points. Pulse, if the pulse is absent, then we will give 0 point. Pulse is below 100 beat per minute, then we will give 1 point. Over 100 beat per minute, then we will give 2 point. In grimace, if there is flaccid, then we will give 0 point. If the some flexion of extremities are present, so we will give 1 point. And if there is active motion, sneezing, cough, pull away is present, so we will give 2 point. In appearance, we will check the color of the baby skin. If the baby is blue or a pale, we will give 0 point. If the body is pink and extremities are blue, so we will give 1 point. If baby is completely pink, so we will give 2 points. Respiration, if the respiration is absent, so we will give 0 point. If the respiration is slow and irregular, so we will give 1 point. If the baby is cry vigorously, so we will give 2 point. If the scoring is 0.3, 0 to 3, so we will say that baby is severely depressed. If scoring is 4 to 6, so we can say that the baby is moderately depressed. If the scoring is 7 to 10, we can say that the baby is in excellent condition. Then we will deal with the topic routine care of newborn, that is ensure warmth, help to establish normal breathing, initiate breastfeeding, prevention of infection, cot care, eye care, weight of the baby, examine the baby, give vitamin K and monitoring the baby. In first, we will deal with the ensure warmth. At the time of delivery, how can ensure warmth? Ensure delivery room is warm, that is 25 to 26 degrees centigrade temperature, and dry the baby immediately and remove the wet cloth and cover the baby with clean and dry cloth. Keep the baby skin to skin contact with mother on chest or on abdomen and postpone the bathing or sponging for at least 6 hours or a next day. Then after delivery, keep the baby cloth warm with the head cover. Avoid bathing, especially in cool weather or for small babies, and keep the baby close to the mother. Use kangaroo care for low birth weight babies and for rewarming stable babies. And show the mother how to avoid hypothermia, how to recognize it, and how to rewarm a cold baby. And the mother should aim to ensure the baby's feet are warm to touch. Then we will deal with the helping to establish normal breathing. How we can establish a normal breathing? Firstly, we will have to assess a breathing pattern of the baby at the time of drying. If the baby is cry vigorously or breathing adequately with chest rising smoothly at a rate of 40 to 60 breaths per minute, then no intervention is needed. If the baby is not breathing or gasping, then the positive pressure ventilation may be needed. In initiating breastfeeding, skin to skin contact is needed for the baby and the mother for ensure early initiation of breastfeeding, and the baby will usually open his or her mouth and start to move the head from side to side. He may also begin to dribble, and this sign indicate that the baby want to feed. And the most of the babies are ready to take feed within 30 minutes to 1 hour. If the baby is not taking a does not latch on first feeding, initial feeding, so don't give any other feed other than the colostrum. And prevent from infection. Babies are secure placed in their mother womb, and they have to be protected from adverse environment of the surrounding. So cleanliness at the time of delivery reduce the risk of infection for the mother and baby. Also prevent the baby from neonatal sepsis and tetanus. And cleanliness require mother, families, health professional to avoid harmful traditional practices. And hand washing is the single most important step to be emphasized, and the clean chain has to be followed at the time of delivery, then the time of discharge. Clean delivery, WHO has a 6 cleans, that are the clean attendant head, clean delivery surface, clean cord cutting instrument, that is razor, clean string on to tie cord, and clean cloth to cover the baby, and clean cloth to cover the mother. And after delivery, all caregivers should wash hand before handling the baby, feed only breast milk, keep the cot clean and dry, do not apply anything, use a clean absorbent cloth as a diaper, and wash your hand after changing diaper and napkin, and keep the baby clothed and wrapped with a head covered. Then the cot care, during the cot care, firstly put the baby on the mother's abdomen. If it is not possible, then place the baby on a clean, warm, dry surface close to the mother, change gloves and put tie using a sterile tie and tightly around cord at 2 centimeter to 5 centimeter from the abdomen, and cut between the ties with a sterile instrument. For example, that is a blade, and remove blood or meconium by wiping with clean cloth, not the vernix caseosa, and observe for oozing blood. If blood oozes, place a second tie between the skin and first tie. Do not apply any substance to the stump. Leave stump exposed and nothing should be placed on it. If a stump is soiled, then wash it with clean water and dry with a clean cotton cloth. In eye care is important for the protect the baby's eye from the infection in area where sexually transmitted diseases are common. That is Eye care is needed soon after delivery because infections such as gonorrhea can be passed during the birthing process, which can result in blindness. So what we can do? So we can do that is clean eye immediately after birth with swabs soaked in warm sterile water using separate swabs for each eye and clean from medial to lateral side and give prophylactic eye drop within 1 hour of birth as per hospital policy and do not apply anything that is castle in the eyes of the newborn. And weight of the baby, the term baby lose their weight during first 2-3 days of birth up to 5 to 7%. And due to removal of vernix, mucus, blood, passage of meconium, and reduction of extracellular blood volume. And they gain weight next 1-2 days and return back to birth weight by end of first week. And the term babies gain weight 30 to 20 gram during first and second month. Vitamin K. Vitamin K is needed for protect baby from serious bleeding, and vitamin K given intramuscular injection that is 1 mg for every newborn and 0.5 mg for less than 1000 gram of baby, and encourage mother to breastfeed their baby during the injection for comfort. And examine the baby. A complete examination should be performed within about 60 minutes after birth. Count the number of breaths during 1 minute. Observe the movement of limb when awake in their position and not moving and their tone, and observe the skin color of the baby. Body areas for Inspect the body areas of the baby for finding abnormalities, that is head, face, mouth, palate, chest, abdomen, genitalia, anus, limbs, and skin. And a well baby should have a normal temperature, warm to touch, and pink in color with weight of more than 2.5 kg, breathe easily at 40 to 60 breath per minute, and move his arm and leg equally when active and rest, and explain to mother the examination findings and to allay her concern and document in case record. And monitor the baby. The three most important parameters that need to be monitored in every 15 minutes, that is breathing, temperature, and color. In breathing, listen for grunting, look for chest involving and fast breathing. Temperature, check to see if baby's feet are cold to touch by using dorsum of your head. And the color, evaluate the color of the trunk and extremities. Thank you. I hope you all will understand this topic and you don't have any doubts.